Ever pondered if a second opinion is necessary for pediatric surgery? In the world of medicine, second opinions often provide an additional layer of insight. They offer an opportunity to understand your child's health better, especially when surgery is being considered. A second opinion can be invaluable for peace of mind. It allows you to have a conversation with another pediatric surgeon, reaffirming the initial diagnosis or suggesting alternative treatment paths. In complex medical conditions, a second opinion can bring about crucial clarification. It may even reveal different surgical techniques that weren't initially discussed, further expanding your understanding of the available options. Exploring these treatment possibilities can help determine what's best for your child's unique needs, giving you the confidence that you're making the most informed decision. So remember, seeking a second opinion is not about doubting your doctor. It's about gaining reassurance, widening your perspective, and reinforcing your trust in the chosen course of action. A second opinion can provide reassurance, offer alternative perspectives, and solidify your trust in the surgical plan. Under what circumstances should you strongly consider a second opinion? When it comes to your child's health, there are specific situations where seeking a second opinion is particularly recommended. Firstly, if your child has a complex or rare condition, a second opinion from a specialist in that specific area can bring invaluable expertise to the table. This can help ensure that your child gets the most effective treatment possible and that all angles have been considered. Secondly, if the proposed surgery carries high risks of potential complications, a second opinion can offer valuable insight. This can lead to a broader discussion about alternative approaches and risk mitigation strategies. Thirdly, if there's any uncertainty about the diagnosis or the need for surgery, a second consultation can provide clarity. It can confirm the initial assessment or reveal a different perspective. Lastly, if you're uncomfortable with the initial recommendation, a second opinion can empower you to find a provider you feel comfortable with. In certain situations, a second opinion can be invaluable, providing clarity, expertise, and alternative approaches. So, how do you go about seeking a second opinion for your child's surgery? Let's walk through the process step by step. Firstly, it's essential to have an open conversation with your child's pediatrician. Let them know you're considering a second opinion. They should understand your concerns and may even be able to recommend a qualified specialist within their network. Remember, your child's well-being is their primary concern as well, so they should support you in this decision. Next, gather your child's medical records. These records include test results, imaging scans, and surgical reports from the initial consultation. Having these at hand will be crucial as they provide the second surgeon with a comprehensive view of your child's condition and the proposed treatment plan. Now comes the task of choosing a qualified specialist. It's important to select a board-certified pediatric surgeon who has experience in treating your child's specific condition. Utilize online resources and referrals from your pediatrician to find suitable candidates. Don't rush this step. Take the time to research and select a surgeon you feel comfortable with. As you prepare for the consultation, make a list of questions you have about the diagnosis, treatment options, risks, benefits of surgery, and the recovery process. It's easy to forget important points during the consultation, so having a list ensures all your concerns are addressed. Don't hesitate to ask anything that's on your mind. No question is too small or insignificant when it comes to your child's health. Remember, the goal of this consultation is not only to confirm or challenge the initial diagnosis, but also to provide you with more information and reassurance. And finally, understand that seeking a second opinion doesn't undermine the initial surgeon or imply a lack of trust. It's a proactive step to ensure that all bases are covered and that your child is receiving the best possible care. You're doing this out of love for your child and a desire to make the most informed decisions possible. The process of seeking a second opinion is straightforward and can provide you with the information and reassurance you need to make informed decisions about your child's health. Let's recap what we've covered today. When it comes to your child's health, a second opinion for pediatric surgery can be invaluable. It offers peace of mind, provides clarification, presents alternative treatment options, and builds confidence in the chosen course of treatment. It's particularly crucial to consider a second opinion for complex or rare conditions, high-risk procedures, if there's uncertainty about the diagnosis, or discomfort with the initial recommendation. To seek a second opinion, start by discussing with your child's pediatrician. Gather all necessary medical records. Choose a qualified specialist. and prepare for the consultation by making a list of all your questions. Remember, seeking a second opinion doesn't imply a lack of trust in the initial surgeon. It's about being proactive and making sure you're making the best decisions for your child's health.